This year's been huge. So looking back to kind of January, February, we're seeing this kind of unfold in Europe and we're thinking, down under won't come down under.
We're getting lots of reports from the UK and, like all these things. You get lots of rumours, WhatsApp messages. It's horrible.
I've been in this role for 12 years, but starting to prepare for what we felt like was going to be a war, that we didn't know how to fight, that we didn't know what to do or if our processes would work.
We needed to look at how we could manage the volume of people that were coming in safely.
Let's find another 200 staff. How can we do that? Let's do that. And within a couple of days, training all of them to be ICU nurses. Huge.
You'd have a junior doctor with symptoms getting swabbed and then turning up positive, or a nurse. And then the consequence of which would be, a variety of staff who've been in contact with them would be then furloughed.
There was an enormous amount of pressure just making sure that everyone got home safely at the end of the day.
At Royal Melbourne, we've had a little bit of experience through Flinders Street, Burke Street fires in the way we've been able to manage that. So it's about applying the same principles to emergency management as you would to any large-scale disaster.
I think we did as much preparation as we could. And then it started to be, this is actually real.
We were being asked to go into the towers and do the screening and testing. Our staff were incredible, the way they approached the people living in the tower.
We had a residential care facility that clearly was not coping. We decided to open up one of our wards in Royal Park, AC4, which was empty at the time, to cater for, basically an evacuation of the residents who were infected.
In our plan, we didn't have that we would be working in the towers, for example. We didn't have that we would be staffing residential aged care facilities. So agility was sort of key, and people's willingness to come forward.
COVID just strips the humanity out of looking after a patient. There's no interaction. You're behind masks, shields, gloves. There's no touch.
The nurse at the bedside tried to walk in the shoes of those that were going through these really challenging periods of not being able to be together.
Seeing people who couldn't have their families visit. That was probably the hardest thing in my 23 years in the unit I've ever had to do.
The iPad communication tool, which was great, but obviously you were in the room holding the iPad for some very, very sick patients and potentially saying goodbye.
But there was real sensitivity shown to, people approaching end of life.
We've grown together so much more. We're even closer than we've ever been, and I didn't think that was possible.
I can't think of one person who didn't go above and beyond.
Nursing, medical, allied health and all the support services absolutely rose to the occasion.
I'll always be grateful for those that did go over and above, and I wish I knew all 10,000 plus staff could write them a personal note saying thank you so much for all the incredible work you've done.